Interested in all things psychology? You are at the right place. Here, we bring exciting and thought-provoking ideas. We travel into our minds and some things out of this world. Welcome to the Psychology Debrief.
Hi, and welcome back to the channel. I'm joined today by Dr. Michael Evangeli, who's one of our resident experts in clinical psychology. Michael does a lot of work in the area of HIV, but today what he's going to talk about is his role on the clinical doctorate scheme that we have here at Royal Holloway, going through exactly what a clinical doctorate is, as well as how you can kind of improve your chances of getting onto these sorts of schemes. So I think probably just before we get started, it's probably just worth noting to our listeners that although some of the things you're going to talk about today may have some applicability to a wide range of schemes that are available across the country, sort of entry requirements, what might make good practices to try and think about how to bolster your chances of getting on those schemes. You really, to some degree, can only really specifically speak to the scheme that we have here, which is the one that you work on. I think one of the things that's a good place to start with a clinical doctorate, and obviously there are lots of people that are interested in applying a clinical doctorate, but my role in where I am in the Department of Psychology, and I work often in our undergraduate scheme, is I have a lot of students who come to me who have strong aspirations of going into clinical psychology and particularly talk about wanting to get on the clinical doctorate. And one thing is that often they don't necessarily have a strong understanding about what actually a clinical doctorate is. So I was wondering if maybe, first of all, you could just kind of outline, what do we mean by a clinical doctorate? And maybe how does that differ from, say, maybe doing a master's in clinical psychology, as well as maybe doing a PhD in clinical psychology?
Yeah, that's a really good question. I mean, the principal difference is the outcome. So when you complete a doctorate in clinical psychology, you are now a qualified clinical psychologist. So you can use the title clinical psychologist. You can work in the NHS or privately as a clinical psychologist, offering therapy, for example, different populations. So it's a training program over a 3-year period, and the outcome is you're now qualified as a clinical psychologist and recognized as a clinical psychologist. In terms of the degree itself, it's a mixture of academic research and practice-based activities. So roughly half of the training, half of the 3 years, is working in clinical practice under supervision in the NHS across a variety of different specialties. 20% of the time is in academic teaching, being taught about clinical psychology. 20% of the time is research involved in with the outcome of a major research project at the end of the 3rd year, which the individuals vied on, and 10% of the time is private study time. So the degree itself is a mixture of both kind of academic and research requirements on one side and clinical and practice requirements on the other side. And that differs from both the MSc in clinical psychology, which is obviously at a lower level academically for a shorter period of time and doesn't confer the title clinical psychologist, not a professional qualification, and a PhD, which is solely research over 3 years, as opposed to the doctorate in clinical psychology, which, as I mentioned, has a research component, but it's a small component of the overall degree.
Yeah, so I mean, for any student that's potentially interested in a clinical doctorate, just to kind of reiterate the point that you sort of said, a master's in clinical psychology is very much kind of taught like an undergraduate degree, but it doesn't confer the kind of title of a clinical psychologist at the end of it. You would need to go and do a clinical doctorate instead. And then the real major difference between the clinical doctorate and a PhD is very just based in research. You can do a PhD in clinical psychology. We do lots of clinical based research, but you wouldn't necessarily get the professional practice and training and skills that you would get in a clinical doctorate. Is that a fair sort of summation of those differences?
That's right, yeah. So the PhD, the research component's at the same level as the research component in a clinical psychology doctorate degree, but it's the extent of the research is greater. You're doing research solely for a 3-year period usually, whereas the research component in a clinical psychology degree is, as I say, one small component, and it's only the clinical psychology doctorate that results in the clinical psychology qualification being converted.
Okay, brilliant. So I suppose something that I think is also worth exploring for a little while is why do one? So what necessarily, obviously you get a nice fancy title at the end of it, which is obviously one of the great reasons of doing any sort of degree, but what are really the actual kind of potential uses of a clinical doctorate? Why might someone come onto this scheme? And typically with our kind of graduates, where do they go afterwards? What do they end up often doing as a kind of career?
I mean, it is a good question because, I guess people are doing the degree for all sorts of different reasons, from, personal reasons as well as, career-related reasons. I think that there will be some people where a PhD is more suitable, where their interests are solely in research, and that's really where they want to focus on, and they see a career in academia or a career in research as being their aspiration. And for those individuals, a PhD might be more suitable. I mean, usually it's the case in terms of career aspirations that people who are doing clinical psychology as a doctoral degree want to work as a clinical psychologist. And for the majority of those people, I think what they want to be doing is offering interventions and therapy for particular populations. So if you look to see where our trainees, I use the word trainees, that's what the term that we use, trainee clinical psychologists. So when people qualify and they're no longer trainees, the vast majority are working in the NHS in London, because that's where we offer placements. And of those trainees, roughly half are working with children and adolescents, or roughly half are working with adults. There are smaller numbers that do go on to work in academia. People who work in other settings, doesn't have to be the NHS, could be working privately, social services, in kind of third sector organisations. But the vast majority of people are going on to work as a clinical psychologist, usually offering therapy and interventions for particular populations in the NHS. And that's why the NHS funds the training, because they hope that trainees, when they finish the course, will go on to work in the NHS and will, add to the NHS workforce.
And so something else that also is a common question that I get from students when I see them that are interested in doing clinical doctorate is, how can they really kind of improve their chances of getting on one? I think this might be a correct statistic, but I'm pretty sure the clinical doctorate is like one of the hardest kind of schemes to get on. I don't know if we have any actual kind of statistics that you can share about how competitive they are, just to kind of illuminate how competitive they are. But more generally as well, if you're going to advise someone who maybe is thinking in 2 or 3 years' time, I'd love to do this kind of thing and go on a clinical doctorate, what should they be doing? Obviously, a student would want to get good grades, but what else, apart from just educationally showing that you can get a 2-1 or a first at undergrad or master's level, what else should you be doing?
I'll try to answer kind of different elements of that question, if I will. You're right. It is a particular process to get onto a clinical psychology doctoral course. The success rate varies over time. Currently, or in the last kind of year or two, the success rate's been around 20 to 22%. So that means for every individual applying, and people get to apply for 4 courses across the country, amongst roughly 30 courses that offer clinical psychology doctoral training. You have just under a 1 in 4 chance of getting on in that year. So the success rates for individual universities vary. Royal Holloway is one of the more difficult courses to get onto. We're very oversubscribed. But the success rate has improved over time. So over the last few years, there's been quite a significant improvement in success rate, partly because the number of places on offer for NHS training as a clinical psychologist and the doctorate has increased quite significantly. So for Royal Holloway, for example, for many years, we had 29 trainees for each cohort. And then in 2020, it went from 29 to 40. In 2021, it went to 53. And then the cohort starting in 2022 will be 59. So we've gone from 29 in 2019 to 59 in 2022. So a very significant increase. There has been a slight increase in the number of applications, but not to the same degree as there has been an increase in the number of places. So overall across the country, is around about 4,500 people apply for clinical psychology doctorate training, for just under 1,000 places last year. It's difficult to get onto a clinical psychology training course, but not impossible. I think that's a really important message that I want to ensure gets out there. What's going to increase the chances of someone getting onto clinical psychology doctoral training? I mean, I'll start with the academic performance, because it is important. There's no denying that. But I mean, for Royal Holloway, we look at a range of academic markers. We don't just look at undergraduate degrees. The undergraduate degree that we look at is the degree that confers graduate basis for chartership with the BPS. So for most people, that will be their undergraduate psychology degree. For some individuals, they'll be doing a conversion course, and that's the degree grading that we look at. We also look at A-levels. We look at postgraduate qualifications, masters gradings, if someone's done a PhD, and we look at peer review publications. So we look at a wide range of things, and what I'd encourage people to do is to think about whether there might be any potential for any work that they've done, research work that they've done, to be published, to be an author on a piece of work. That will make a difference for us at Royal Holloway, because there'll be lots of people with 2-1s, for example, and a proportion of people will have first. So, but we don't just look at academic performance. We look at 2 other things in our screening and shortlisting process. The other 2 things are clinically relevant experience and references. In terms of clinically relevant experience, we at Royal Holloway don't ask for a great deal. So all we ask for is that when someone starts the course, they have a year or more of clinically relevant experience. So that means at the time that they're applying, and may only have just a few months, because the applications are due in November or December of the previous year for September entry. What is clinically relevant experience? So the first thing is that it can be both paid or voluntary. So we look at voluntary experience as well as paid experience. We do ask that some clinically relevant experience is paid, because it's usually a marker of responsibility or the kind of level of complexity of the experience. And the clinically relevant experience can be either research or, in a clinical or therapeutic setting. And the key element is that we would hope that people would have experience working with the populations that clinical psychology see. So normally that would be people with mental health difficulties. Sometimes it can be people with physical health difficulties, where the focus of the work is psychological. There's some counselling process going on, or there's some psychological process which the candidate has been involved in working on with the client. And then within that, we look at the type of experience that the person has undertaken. So, they undertaking assessments as well as intervention. They're doing individual work, group work. Who are they working with? So we look at a range of different kind of elements associated with the clinically relevant experience. And the final thing is references. So the candidate has to have references from 2 individuals, one academic reference. So that can be from a research tutor at undergraduate level, or if they worked as a research assistant, it can be their supervisor. That's up to the candidate to choose. So there's some choice there, and I guess it makes sense for the candidate to choose someone who knows their work well and is able to write a reference which shows some understanding of their work. And finally, an experience reference, which could be from a current supervisor or someone that has supervised the individual on some postgraduate work that they may have done, or even work that they've done as a volunteer during their undergraduate degree. So what I'd encourage undergrads to do is to see if they can take advantage of any opportunities that are on offer, perhaps working as a voluntary research assistant, if that's possible, to think carefully about experience that they can pick up over the course of their undergraduate degree, to think and maybe have a conversation with a supervisor about whether there might be an element of research work that could potentially result in a publication. So I think there are things that undergrads can be doing. But maybe my final kind of comment, and this really comes out of a survey that we did a few years ago with with trainees on the courses when asked about their pre-course experience is rather than think about the outcome of getting onto a clinical psychology course, really choosing experience that you're interested in, that you have some commitment towards, that you're going to find helps you develop as a person, as a practitioner, and really focusing on making the most out of that experience rather than necessarily thinking about whether it's going to be helpful or not to get onto a clinical psychology course. If you can do that, I think then maybe the chances are it probably will assist, but also you'll get more out of that experience as well, and it will be useful and rewarding.
Yeah, I mean, I get the sense from what you're saying. Obviously, it seems like at least at Royal Holloway, there's been more and more applicants, so there's more chance to get on a clinical doctorate scheme as time has gone on. But really, the kind of key thing for anyone who's interested, particularly if you're currently an undergraduate student, is just try and get involved in opportunities. We've talked on this podcast show before about gaining research experience, why you would do it. We've talked about how to gain that kind of research experience. As you kind of said, seeing if there's research assistant posts, maybe in your third year project, is there publishable findings? If you found something which you think is really interesting, talking to your supervisor about maybe whether they're willing to try and work with you on that. And as well as going out there and getting real world experience as well. Again, if you're a kind of undergraduate student, normally your university will show lots of opportunities and have lots of links that you may be able to find as a good resource to try and find this kind of work that you were describing. But obviously there are other ways that you can find kind of clinical relevant work that's going to help get you onto these schemes. But the key thing is really start doing it now, so that in a couple of years' time you'll be in the best position to start applying and really hitting the kind of things that Michael sort of outlined, I think quite clearly and eloquently, as to what at least we here look for in our trainees. So let's talk a little bit now about how a clinical doctorate actually works. You spoke a little bit earlier about how it's going to divide into different sections, like the skills, the training, the teaching, and the research. I'm wondering if maybe an easy way to kind of do this is outlining kind of year on year, how does each kind of year work if you're a trainee? So when you first arrive, what are you doing in year one? And then what happens in year two and year three? If we can kind of give a brief overview to how the course works.
So when a trainee arrives, so our trainees that will arrive in September of this year, they'll start with a 1 month induction block. So that is a month of taught material. So they'll come into college, or some of the taught material will be online. And the aim of that induction block is to set up the trainee clinical psychologist for starting work under supervision in the NHS in late October. So the first placement will start in late October, and then there'll be that placement experience will occur over the course of all 3 years of the programme. But in the first year, normally the trainee will be on a year-long placement, often in an adult mental health context. So that placement experience will be usually 3 days a week over the course of the first year. And after the induction block, the academic teaching goes down to 2 days a week during term time. And that will be the case over the course of the whole of the first year. And then the research component only really comes in towards the end of the first year, around about May or June of the first year, where the trainee will be asked to select who they want to work with and which project area and specific project will be their major research project for the course of the remaining 2 and a bit years of the program. So to summarize then, I mean, the first year has a significant talk component, an induction block at the beginning, and then 2 days a week in term time for the rest of the first year, a fairly minimal research component, and then a placement component, which is 3 days a week from October the first year until September at the beginning of the second year. And that pattern continues in a similar way in the second year, in that teaching is 2 days a week, placement is normally 2 or 3 days a week. But over the course of that second year, there are more and more days set aside for research. until in the summer of the second year, because I think one thing that's really important to state is that the training is full time. It's even though the academic component follows the college timetable, you're working in the NHS, and you are at the same time as being a student also on an NHS contract and being paid as an NHS employee with the same rights as anyone else working in the NHS. The second year follows the pattern that I've outlined. The third year follows a slightly different pattern in that the academic component is minimal. There's very little teaching, and those days are really set aside for research, and the 2 to 3 days a week on placement continues until the end of the course in September of the third year.
And so I'm just wondering, I guess it's a slightly double-barreled question. I think, first of all, let's deal with these placements that you talked about. I'm wondering how much flexibility there is, because obviously clinical sort of related issues are very, very diverse. How much flexibility is there for maybe a trainee to kind of get specific experience on a specific type of kind of clinical based issue with the NHS? Is it you get a more general overview, or is there opportunity to kind of tailor your placement in relation to maybe your interests specifically?
Yeah. Okay, I mean, that's an excellent question. I'll say a little bit about the placements first. Trainees at Royal Holloway, they have access to a very wide range of placements, partly because the allocation of placements is done collaboratively with UEL and UCL. So all three courses work together to allocate placements across the whole of the North Thames region. So there's a very large number of placements. Normally what happens is over the course of training, the trainees' preferences are taken into account increasingly over the course of the 3 years. So there are certain competencies that need to be picked up and skills that need to be developed. And because of that, the trainees are allocated placements, as I say, normally in adult mental health context in the first year. Then subsequently, the placements in the second year usually are 2 6-month placements, one of which is a child placement, because it's important for the trainee to pick up skills across the whole of the age range. What happens in our course is that midway through the training, so at the beginning of January or February of the second year, the trainee meets with a clinical tutor and goes through the skills that they picked up and talks about their preferences and what they might want to specialize in as they're going towards the second half of training, the end of the second year and into the third year. And the clinical tutor, along with other clinical tutor colleagues, will try to work together to try to allocate placements which allow for those preferences to be pursued, whilst ensuring that the key competencies that allow you to be qualified as a clinical psychologist are met. So, for example, if a trainee really wants to focus on pediatric health setting, many opportunities in the North Thames region, areas of regional and national importance and expertise, and there's a reasonable chance that the trainee will be able to specialize in those areas as long as they've met their competencies in other areas. So they may do a child placement in the second year, but they may also do maybe a specialist pediatric health placement in the third year, so that they're working towards developing higher level competencies in that particular area. And that may be the area that they want to work in when they finish, and that may place them in a better position to be competitive against other candidates when they apply for jobs as a qualified clinical psychologist. So in short, the opportunities to pursue interests are certainly there, and then they increase over the course of training over the 3 years.
And so I guess my next question is kind of similar to my last one, which is now more focusing on the research side of things. Firstly, again, how much kind of scope is there for sort of trainees to have a research project that is something that they're really, really interested in? So how does kind of getting that research side of things working start? Do students kind of trainees rather get kind of free range about what to do? Do they get selected a project that they have to do? How does it precisely work for those who are interested in understanding more about the research angle?
Okay, so there's certainly much greater kind of choice component than there would be at undergraduate level or even master's level. What happens is Royal Holloway, the internal members of staff, so the members of staff working on the clinical psychology course, will present various ideas and projects to the trainees, normally around May of the first year, and a number of members of the main psychology department will also present ideas of which are focused on areas relevant to clinical psychology. In addition, there will be people from the NHS who suggest ideas to us, which we forward to the trainees. And so the trainees have a fair amount of choice within the areas that are presented to pursue their research. I mean, that doesn't mean that a trainee can't develop their own idea, perhaps based on experience they've had previously. That's also supported if there's expertise to supervise the trainee in a particular area. But we're quite lucky at Royal Holloway in that we're a relatively large course, so we have quite a large team covering a number of specialties. So the hope is that the trainee can develop an idea within the expertise of the members of the course team. And from that moment on, once there's a relationship between the trainee and the member of staff secured, then the people will develop a project, and then there's various processes to ensure that project meets the needs of the doctorate. So it will need to be novel, it will need to be clinical importance, and most importantly, it needs to be doable in a timescale, because particularly for projects that are recruiting patients from the NHS, if one needs to undertake and go through NHS ethics, that can be time consuming, and there's only a limited amount of time to collect data. So we support a very wide range of types of projects, primary and secondary data collection, recruiting clinical and non-clinical samples as long as the project is clinically relevant, recruiting for the NHS from outside of the NHS. And at the end of that time, in July of the third year, the trainee will be vived in the same way that a PhD student will be vived, albeit on a smaller volume of work, and the viva itself will be shorter, but it's still a rigorous process examining at a doctoral level, just as I say, on a smaller project, roughly equivalent to a PhD sub-study. And for some of those projects, they'll be written up and will be published in peer-reviewed journals, and some not so.
Yeah, so I think that kind of leads me into my final question, because I was going to ask a little bit about the thesis that trainees write. So you obviously said they get vivaed at the end of it, which is a sort of an oral examination of what you've written. Maybe can you just speak a little bit about what actually goes into the thesis then? What necessarily makes up the components of this thesis, and sort of typically how long are these theses?
Okay, so Royal Holloway are part of the University of London, so we're bound by the University of London statutes. So for a doctoral thesis, that means that it's a 25,000 word minimum. There's no maximum, but the majority of the theses that are submitted are between 25,000 and 30,000 words. There's 4 components for our thesis. The 2 main components are a systematic review and an empirical piece. They should be related to each other, so the systematic review should support the empirical work. Both of those should really be a publishable standard, and those are significant pieces of work. In the thesis structure that we have, they're bookended by 2 sections. The first section is a lay summary, so just a short 1,000-word summary of the thesis as a whole, but written for a lay audience. And then the final section for our thesis is a section which focuses on the trainee reflecting on the work and explaining the relationship between the different components of the thesis, and then also focusing on impact, the potential impacts of the findings, and how they might be maximized through a dissemination plan. So that it may or may not be the case that the trainee undertakes the dissemination plan in full, but they're likely to undertake some of those activities that they've outlined. So those 4 components, the lay summary, the systematic review, the empirical piece, and then this reflection, impact and dissemination section, form the 25 to 30,000 word piece of work.
So I think that's all that we have time for. Michael, thank you very, very much for what I think have been really, really insightful answers about what a clinical doctorate is and how you can kind of improve your chances of getting on one. For any of you who are listening, if there's any kind of questions that we didn't cover that you are interested in finding out more about a clinical doctorate, then I suggest getting in touch with the Psychology Debrief. Maybe we can have Michael back sometime just to kind of cover those more specific questions from kind of prospective trainees where maybe we didn't cover that information in this video. But again, Michael, thank you so much for coming on today, and I hope you have a good day.
Thank you for watching the Psychology Debrief. If you have any suggestions for new topics, quizzes, or any other content psychology related, feel free to get in touch via email or Twitter. Don't forget to like, share, and subscribe. Bye!